But here's the argument. So manual therapies, they provide short-term pain relief, and they last very short periods of time, sometimes just minutes, right? Oftentimes, these are small improvements, and they may be clinically significant, but are they really clinically relevant? There's a great study by Chad Cook, or just commentary, 2011, Journal of Manual Manipulative Therapy, and it's in the show notes if you want to check it out. And his argument was that, yeah, these are clinically significant results in these studies, but how clinically relevant are they? They're not going to provide a huge effect, right? So that's one shot against manual therapies. So the other piece is that manual therapies tend to be no better than exercise for long-term outcomes. I got to tell you, I included a study here on manual therapy for the neck, and it just showed that there is no difference between manual therapy and exercise, but there's a lot of research out there. I definitely recommend you check it out. Again, I'll put that study in the show notes. So here's the thing. If I am going to get the same outcome long-term by doing manual therapies versus just doing exercise, and why would I, right? And that makes sense too. That's a valid point. So the other part is that manual therapies are widely misunderstood in our culture. And I'm talking about from a patient perspective. Patients tell me all the time, like, oh man, we need to break up that scar tissue, right? That manual therapy is getting out all that bad stuff, getting all that lactic acid buildup out, right? That's keeping me in pain, right? I got to tell you, I tell folks all the time what the manual techniques I'm doing are doing for them, but they still come back and say like, man, I think you're breaking up that scar tissue, right? So whatever reason, it's really tough for people to comprehend in our culture, and it's just widely misunderstood, right? And the other thing is that some patients may think that they need it, right? They may think they need to go to a physical therapist or chiropractor to get their neck realigned or their spine realigned, right? And that's the only way they can get out of pain, and they won't improve without it. And obviously, we know that that's not necessarily true. And if you guys are interested, I took this information from the Journal of Dan Pope's Personal Experience, January 2021. That'll be in the show notes as well. Obviously, that's a joke, guys. It won't be there. Here's the other thing. Manual therapies have a neurophysiologic effect. We know that when we do a manual technique that can reduce inflammatory markers, it can decrease spinal excitability and pain sensitivity. It modifies cortical areas involved in pain processing, right? So it does stuff. But are these real changes, right? Are we changing the muscle? Are we changing the tissue with our manual techniques? And because we're not necessarily changing the tissue, oftentimes manual techniques get discounted, right? Because they're not doing the same thing strength training does, right? Or an eccentric, where we're truly lengthening tissue, right? We're making a tissue stronger. So that's another knock against manual therapies. The other piece is that in many studies, there's a lot of them out there at this point, manual therapies have a similar improvement to pain and function as a sham procedure, right? So like manipulation, if you do take someone's neck to end range and just hold it for 30 seconds versus you actually manipulate the neck, you're going to have an improvement in both of those folks, right? So then the idea becomes like, oh, wow, what we're doing is just a placebo. And the thought from there is like, well, is manipulation valuable? Is it real? It's just a placebo. Why do I even do that, right? And if you want to see this research, I'll include that in the show notes as well. So the other argument against manual therapies is that they cause patient reliance, right? Patients are going to need us in order to get better. And this is not great because it shifts that locus of control. So basically, patients believe they need to go to someone to get manipulated, to get soft tissue work, to get dry needling, whatever it is, so they can actually get better. And the problem with that is that we know that's not true. People can become self-reliant. If they do their own exercises, they have behavior modification, they can get better without a physical therapist, right? And to be honest, I couldn't find any medical literature that shows that manual therapy causes reliance, right? But I've certainly seen this happen, and I can definitely, it logically makes sense. I can see it happening for sure. A physical therapist can say, you need my techniques in order to get better. A chiropractor can say the same. You need to come back every month for the rest of your life so that your pain stays at bay, right? We know this isn't necessarily true, and it certainly can happen.